communities are facing an intersection of multiple public health challenges. This includes political and social rollbacks regarding basic human rights and principles that many communities have relied on. It includes misinformation and mistrust of organizations and of just the very basis of knowledge itself. This includes undermining of public health and educational institutions that motivate and advance public health. Because of all of these forces, it's really the responsibility of public health to find new solutions to these emerging and re-emerging challenges.
So we at the Rollins School of Public Health have a vision that all of us can lead our healthiest possible lives in every population and in every community around the world. And we think that we can help to achieve this vision by bringing our excellence in research, in education, and in our practice partnerships to bear to meet the needs that are set by communities across the globe.
The mission of Emory Centers for Public Health Training and Technical Assistance is to advance public health practice through capacity building with community partnerships nationwide. We could do a lot of academic research on what works, but without inclusion of the community and our community partners, those who do it on a day-to-day basis, it will sit there on a shelf and not be picked up and used. I asked our existing community partners and our state departments of health, what do you need? Where are your burdens? Where are the issues you're struggling with in getting the work done in community? And by listening, they identified some key challenges. That being, we know what to do, we just don't know how to do it. And so when we dug deeper into the how, it became having the skills, the capacity, the understanding, the priorities, and the people to get the work done.
In public health, we have this ideal feedback loop where we think research should inform practice and practice should inform research. But in reality, there are a lot of time lags that keep scientific research from getting to communities to implement in practice. And then with practice, there are challenges with getting that information back to the researchers to inform their research. And that's where I think Emory Centers is really uniquely positioned to speed up that feedback loop.
It's like keep communicating, keep meeting, keep talking.
The Diabetes Training and Technical Assistance Center, or DTAC, is a national training entity that provides lifestyle coach training and support to individuals around the country from organizations and states who are delivering the CDC-led National Diabetes Prevention Program. DTAC helps states, organizations, communities, and individuals address type 2 diabetes prevention by providing lifestyle coach training and support, which is the workforce of individuals who deliver the National DPP Lifestyle Change Program. Most importantly, it impacts participants because oftentimes participants come into the program having tried many different approaches, and what they often find is a non-judgmental place where they're able to kind of solve their own problems and come up with their own sustainable strategies for building new habits.
To learn what I needed to know to be able to help other organizations throughout the state.
Collaboration is important because diabetes prevention is a big problem and a big challenge, and so you need lots of partners on board to deliver the program in the best way that you can.
Emory Centers has made an impact in community is in the scaling of the National Diabetes Prevention Program, in particular the Lifestyle Change Program. What they really needed was a more cost-effective approach where we trained them how to be master trainers, and then they could go ahead and continue and do it themselves.
We have to collaborate with the folks on the ground that are telling us we need more of this or more of that so that we can adjust our trainings and develop things that best meet the needs of those out there delivering the program.
Because the Diabetes Match Initiative brings together our state health department folks, healthcare providers, insurance companies, community-based organizations, large national associations and organizations, we are really focused on collective impact and doing collective impact for this work. How do I see Emory Centers shaping the future of public health? We are so well connected and we are working in all sorts of health topic areas. And that's where I see us being able to learn from those, build off that. What is happening in HIV practice that we can translate to diabetes practice? What are we doing in diabetes that we can use in Alzheimer's and dementia, in climate and health? We are working in such an array of topics. That's what I think is how we're shaping the future, is really breaking down silos across health topics and being able to learn from practice.
And when times get tough, that's when the leaders emerge. It's easy to lead when things are going well. It's so much harder to step up when things are challenged, when resources are low. But this has been the world. That's what we do. We come together when times are tough.
The Emory Centers will always prioritize the people and the communities that those people come from. And as long as we always put the people first and ensure that people have access to what they need and we stay focused on advancing health equity, I think that Emory Centers will be a game changer in this space of public health.